All right, so treatment of opioid dependence. Opioid treatment programs. It is estimated that as many as 3 million Americans are addicted to heroin and other opioids, including prescription drugs like oxycodone, hydromorphone, hydrocodone. Patients with addiction are more likely to suffer from mental health problems, and they can be co-infected with HIV, hepatitis, sexually transmitted infections. Treating addiction can save lives and reduce healthcare costs. Methadone is an effective Schedule II drug. It's used to treat opioid dependence, but it must be dispensed and administered through a registered opioid treatment program. The abbreviation for opioid treatment program is OTP. So again, methadone is a common and effective Schedule II drug that is used to treat opioid dependence, and it is administered and dispensed through the registered OTPs or opioid treatment programs. The methadone 40 milligram soluble tablet is only FDA approved for treating opioid addiction. The lower doses are indicated for treatment of pain and for opioid dependence. All right, so let's see. The methadone clinics have to register with the DEA. They use DEA Form 363 in order to operate as an opioid treatment program or OTP. In addition to registering with the DEA, a practitioner has to obtain approval and certification by the Center for Substance Abuse Treatment, CSAT. Once registered with the required parties, an opioid treatment program can dispense and administer methadone for treatment of opioid dependence. An OTP practitioner cannot prescribe methadone, meaning they cannot provide patients with a methadone prescription for dispensing it at a retail pharmacy. Likewise, when used for the treatment of opioid dependence, methadone can only be dispensed by the OTP or the opioid treatment program. So in general, patients have to visit the opioid treatment program every day to receive a supervised dose of methadone. There are instances when patients can receive take-home doses for self-administration. A single take-home dose can be provided for a day that the opioid treatment program or OTP clinic is closed. For example, Sundays or state and federal holidays. Patients can also receive a take-home supply in increasing quantities over time if they are deemed eligible. So let's take a look here at the criteria. So there's the methadone take-home supply dispensing restrictions. So in the first 90 days, which is days 1 through 90, the patient can receive up to 1 take-home dose per week. In the second 90 days, which is days 91 through 180, they can receive 2 take-home doses per week. In the third 90-day period, which is day 181 through 270, they can receive up to 3 take-home doses per week. And then treatment beyond the 90 days or 270, the third 90-day window or beyond 270 days, and then less than 1 year, like 271 days to 364 days, can receive a maximum 6-day supply of take-home medication, which means once a week they have to still go to the opioid treatment program clinic to get their doses for the week. So after 1 year, they can receive a maximum of a 2-week supply, and then after 2 years, they can receive a maximum 1 month supply of a take-home medication, but they must still have, at that point after 2 years of being stabilized on the methadone treatment program, they still have to have monthly visits. So it's kind of like weekly visits, then twice a week, then monthly. All right, so then we're going to look at the opioid dependence treatment in the office-based setting. So despite the availability of the OTPs, the opioid treatment programs, for the treatment of opioid use disorder, opioid abuse, and dependence, this all continues to be an increasing problem. So yes, again, despite the availability of the OTPs, the opioid treatment programs for the treatment of opioid use disorder, we still have opioid abuse and dependence that continues to be an increasing problem. In an effort to reduce opioid addiction and improve access to care, several regulations have been passed since 2000 that expand the treatment of opioid use disorder to office-based settings, including, so there's the Data 2000, which is the Drug Addiction Treatment Act of 2000. Then there's the Comprehensive Addiction and Recovery Act, CARA, C-A-R-A, of 2016. Then there's the Substance Use Disorder Prevention. This promotes opioid recovery and treatment. So the acronym is SUPPORT for patients and communities, and this was enacted in 2018. Then there's Mainstreaming Addiction Treatment Act, MAT. Okay, and that was enacted in 2022. Prior to the passing of MAT in 2022, providers were required to apply for a Data 2000 waiver and receive a unique identification number, a UIN, same as their DEA number, except that an X replaces the first letter, which we've talked about before, to prescribe and dispense buprenorphine as data waived practitioners. Pharmacists were able to verify a prescriber's data waiver online to determine the validity of a prescription. And then, so in an office-based setting, they have to adhere to strict patient limits. For example, there's no more than 30 patients that can be seen in the first year, and they also have to comply with DEA audits. Because the Data 2000 waiver resulted in significant barriers to obtaining treatment for opioid use disorder, such as patient limits and access to buprenorphine, Congress enacted MAT of 2022, the Mainstreaming Addiction Treatment Act, to allow healthcare providers, for example, physicians, nurse practitioners, certified registered nurse anesthetists, and physician assistants who have taken a specific 8-hour training on substance use disorder to prescribe buprenorphine for this indication. Completion of the course is not required before starting to prescribe. Prescriptions for treating opioid use disorder must contain, let's see, the prescriber's DEA number, of course. A practitioner without the required training may administer but not prescribe a one-day supply of medication at a time to a patient while arranging the proper referral to an opioid treatment program, or OTP. This can be done for up to 72 hours and then it can't be extended. And then the last section here, before we look at pseudoephedrine and products with restricted sales, talks about buprenorphine for opioid dependence. So buprenorphine containing products are Schedule III drugs which are available in various formulations. The prescribing requirements, they do differ based on the indication for use. The combination of buprenorphine and naloxone is only FDA approved for treating opioid dependence, while buprenorphine alone can also be used for pain management. Prescribers do not need substance use disorder training to prescribe buprenorphine products for treating pain, but they must specify the indication on the prescription. All right, let me take a look here. So in this chart here, we have buprenorphine by indication dependent requirements. So first we're looking at indication of opioid use disorder. So under prescribing requirements, again, the prescriber has to have the 8-hour course on substance use or opioid use disorder. And then the FDA approved formulations for opioid use disorder include the common one, Suboxone, which is buprenorphine naloxone, and also just regular buprenorphine. And then under the indication for pain management, the prescriber has to specify that the prescription is indicated for pain. And the FDA approved formulation for that is the just plain buprenorphine, which is the Butrans patch.